unambiguous, and our stance uncompromising. PNA members work across the specialist areas of psychiatry, intellectual disability, care of the aged, AIDS and drugs, and addiction services. I noticed Nick Colleen was thinking of the PNA of the 80s when he referred to psychiatric nurses. He wasn't aware of all the RNIDs and others in the hall. Our members have always suffered from lack of resources, underfunding, and often less than ideal working conditions. Of course, there have been some improvements over the years with the building of new units and the closure or diminishing of many of our old institutions. However, investments in our services has not reflected either the expectations of the public or the real wealth that has been generated over the past 15 years. Now we face cutbacks unimagined since the 80s. If the cuts being imposed in Galway are reflective of what is to come, then our services will be very seriously undermined. In East Galway, the HSE sought to cut back on posts committed to development of a comprehensive community service. While staff suffered but tolerated some of those cuts, they reacted with dismay when the HSE told them they were closing down both the acute and the rehabilitation therapy units. Two of our members, Noreen Kenny and Alma White, refused to close the therapies until real alternatives were put in place to facilitate the activation of clients. The nurses protested that the units involved had drawn great appreciation from patients and advocates and were complemented by a number of agencies, including the inspectors. Eventually, the nurses were ordered to close units or be suspended. The nurses, driven by their commitment to patients and patient care, refused and were suspended. A few days later, at an emergency LRC hearing, their suspensions were rescinded. Last week, the Labour Court published its findings on the case, and it instructed the employers to defer the closure of units for 3 months, to engage in partnership discussions, and in inverted commas, to determine the current staffing requirements of the restructured service. The court added that if the question of staffing levels is not resolved within 3 months, the issue may be referred back to the court for a definitive recommendation. I want today to congratulate Noreen and Alma, and indeed the branch officers and committee, for their determination and resolve and their success in the court. In West Galway, another court hearing is pending on the HSE's breach of T16 in relation to privatisation of a hostel service. However, cutbacks are being imposed with a vigour not witnessed in 20 years. Believe it or not, colleagues, meals for day hospital patients are being stopped. Contracts for some agency nurses have been discontinued. Sick leave has been reviewed and replacements reduced to 1 in 4. Staff contracts, including temporary nurses, are being reviewed. The prescription/stroke dispensing of medications, especially high-cost medications, is also to be reviewed. And overtime will be reduced by 50% and abolished where possible. HSE managers and government ministers talk of increases in spending, of protecting frontline care, of prioritising patient care. You and I know they feed the public misinformation. They dress it up in PR speak. They adhere to a PR company mantra. They seem trained to repeat the party line ad nauseum. However, when all veils are torn away, there is only one reality. Our politicians and HSE managers are misleading the public when they declare that frontline care is being or will be protected. Our ministers are grievously misleading the public when they claim patients are not suffering. The PNA cannot prevaricate. The PNA must tell it as it is. Patients are suffering, the aged are suffering, children are suffering, families are suffering, and yes, people are dying because of the government's policy of low tax, low investment in mental health care. At a recent meeting of Horatio, one of our Dutch reps reported that Holland had 1,000 beds for a population of 15 million for child and adolescent psychiatry. And the Finnish rep said that they had 500 beds for 5 million. Ireland has 28 beds for 4 million. Our ambition is to have 100 beds. This will never be enough. This government is a government for the rich and the get-rich-quick brigade. This government has lived by a right-wing motto, and ordinary people have suffered for it. I ask you today, colleagues, what is the Minister's agenda in health? Is it to improve health services or to increase privatisation? 12 new consultants are to be employed in child and adolescent psychiatry in the coming months. They better be magicians as well, capable of running a health service without beds, with no nurses or other team members. We welcome 12 appointments if they materialise, but we hasten to warn specialist services require specialist staff, specialist support and specialist infrastructure. In the case of mental health, this requires ring-fenced and protected funding. Otherwise, monies for mental health will be siphoned off to other services. The issues of child and adolescent mental health services point up the failures of the government in recent years. Through those years of plenty, we have witnessed massive growth in child and adolescent suicide, massive growth in drink and drug-fueled adolescent violence, the increased phenomenon of schoolyard bullying. Ireland has become an increasingly wealthy and an increasingly sick society. There are many in this state, including our present minister, who extol the virtues of a low-tax society. Indeed, we all like to feel of more money in our pockets. However, the lack of money for investment in comprehensive health and social services creates a climate in which standards in society deteriorate, suicide increases, and loutish behaviour often leads to an increasingly violent society. If we have reaped the benefits of the Celtic tiger, we have also most certainly reaped the harvest of lack of investment in health services. Colleagues, can you imagine the uproar if the budget for the road safety campaign was reduced? Gay Byrne would throw a wobbly. The media would be full of it. Yet funding for suicide prevention has been substantially under-resourced. This is unacceptable. Over the years, ministers have cried crocodile tears for families bereaved by suicide. Funding has not matched their tears. Resource allocation has not kept pace with their words of concern for families, for community or for young people. Funding promised for prevention for the 3 years 06 to 08 has been cut from 5.5 million to 3.5 million, a reduction of over 36%. And Dr. John Connolly of the Irish Association of Suicidology described this when he said, "People are just not taking the issue of suicide prevention seriously." People are just not taking the issue of suicide prevention seriously. How right he is. Just as mental health services are badly underfunded, just as addiction services are badly underfunded, so now suicide prevention is underfunded. Every year, around 11,000 admissions are recorded at A&E for deliberate self-harm, or DSH. And DSH is one of the strongest indicators of a future suicide. Best practice requires that all such cases are confidentially followed up by a specialist liaison psychiatric nurse in some areas. Sorry, that should be a full stop. In some areas, the persons involved are offered confidential consultation in buildings devoid of HSE insignia in unmarked offices. Those cases in which there are indicators of underlying mental health issues are offered outpatient follow-up care. The Cork City Services offer a template of good practice in suicide prevention following DSH. In 2006, Mr. Jeff Day of the